Validation. First of all, we validate the tool by comparing reality and 3D reconstruction. As we can see, there is great correspondence between the patient's anatomy in a picture and that obtained in the radiographic study. Thesis: breast reconstruction. Several papers on the use of this tool for virtual planning of the microvascular breast reconstruction flap have been published in the International Journal of Surgical Research. As Dr. Maciá described, the patient undergoes computed tomography, angiography, scanning, and the location of the perforating artery is reconstructed using this tool. Later on, this perforating artery map is transferred to the abdomen so as to extract the tissue to be sutured by microanastomosis at thorax level in order to reconstruct a symmetrical breast. In this publication, we validate the method by showing that the correlation coefficient between distances measured by digital simulation and in the patient is practically 1. Face transplant. This patient suffered from neurofibromatosis with a plexiform neuroma occupying the 2 lower thirds of the face that had grown progressively and produced downwards displacement of tissues by effect of gravity. The patient had lost eyesight in his right eye due to an optic nerve glioma. With this program, we can use tools that are similar to cut and paste for mirror images, nodes, etc. to simulate the removal surgery of this plexiform neuroma that actually took place later on. The program allowed us to observe the great vascular diversity of the plexiform neuroma, which we would confirm during the surgery, as shown by the dilatation of facial veins, and therefore foresee the presence of heavy bleed during the operation. If we apply the same dissection to different virtual donor heads, we can see that given the morphological alterations of the patient's facial and bone structure, not any donor is compatible. For example, this is simulation number 1, where some structures are not covered. Therefore, this potential donor is not compatible. We made more simulations. Here you can see number 4, where despite the fact that the structure was not absolutely perfect, the size and morphology of the soft tissue to be grafted were indeed adequate for the patient. These tools can also be used for post-operative follow-up. In this case, comparison between patient's CAT before surgery and 3D reconstruction obtained with a different method. In this case, white light scanning from the patient's surface. In this image, we see post-operative result 60 days after the operation and how most of the face, the 2 lower thirds, has been reconstructed.